Yes, sir. We can
Yeah.
start. So I had introduced you before you joining, and for the audience, I would just like to tell everyone that today's session is a question and answer session. So we have received some questions regarding our upcoming webinar, and I'll be asking sir about them. And the first question, sir, is whenever a cancer case comes to us as a homeopath, so how we should decide that we have to take that case and how we should proceed in that case? Like, are there some criterias that we should look for?
Yeah. So definitely there are criteria. See, we should be very rational in accepting any cancer case. Huh? So we should definitely, in whatever stage or whatever type of cancer the patient has, we have a role to play. But it does not mean that we are able to cure cancer or we will treat any cancer and it will get better. It does not work like that. So the truth lies in between this, that we can help everywhere and we cannot help in some cases. So where is the truth? So when a patient comes to you, no, suppose a patient comes to you with prostate cancer, then what you should look at is, first you should study the prostate cancer itself and see what is its in general prognosis, what is its life expectancy, what are its clinical features, etc. And generally you will see that prostate is a slow growing tumor. It is not very aggressive, and therefore the life expectancy is high. So you should take up such cases. And especially the second important thing that you should look for is the background, whether the patient has any background illness like diabetes, blood pressure, etc. If the patient does not have anything, then the prognosis is even higher. Then you can really think of stopping the cancer's growth and not letting the patient develop cancer, etc. Generally, I advise patients that if it's a surgical case, then they should go and do surgery, because surgery, I see, is pretty effective in cancer. The problem comes when patient, also wants to take chemotherapy, radiation, because we know the chemotherapy itself or the radiation itself will have side effects and is going to sort of weaken the patient's immune system, and that will not really help what we are trying to do. We are trying to, as a homeopath, we are trying to stimulate the immune system, strengthen the body, improve the immunity so that the body fights the cancer. So what we should do is, we should take a very calculated move as to, first, what is the stage of cancer, what is the type of cancer, what is the prognosis. If it's a very aggressive cancer, then maybe you suggest patient to take chemo and radiation along with your treatment. If again, you have to support it with clinical data, with research data. What are the research showing, how effective is chemotherapy in such patients, etc. But while I tell you all this, what I want to say is, for all practical purposes, no, patients who come to us are patients who do all of this and then they come to us. Majority of patients are those, actually. So actually you don't need to, worry about whether I should take up this case, whether I should not take up this case. Out of practical uh, aspects, that patient comes to you only after doing all this, only after all this has failed. So you should very, very confidently and very, very uh, um, enthusiastically take up this challenge. And it is only when you show good results in such advanced pathologies that you really understand the depth and value of homeopathy. So to sum it up, basically, first study clinical data so that you know what you are treating and what is your scope and limitation. And second is, take
Yes,
up all cases, because for all practical purposes, patients are going to come to you after taking all this.
true, sir. True. So, so the next question would be, as we know, cancer is a very long-standing disease. So, when patients come to us, can we give some symptomatic relief which is quicker, like at least the patient feels better with his severe symptoms that he's having? So, can we do that?
Definitely, we can do that. And see, Karishma, when a patient comes to us, and as I said, that patient come to us only after they have taken all this therapy, and only after nothing is working, they are coming to us. So the first thing you see is majority patients are coming to you for relief only, because already they know I'm going to die, already they know my pathology is advanced, already they know all other treatments have failed. So majority of cases that are going to come to you and me are those cases who are firstly looking for symptomatic relief, and they want you to give some quick relief. That, Arey, how doctor, my mother is not able to eat, at least give something that she starts eating today. At least give something that she does not have this cough, or she does not have this pain, and she's able to eat, she's able to sleep. That is the main concerns of the patient. Relieve my pain, relieve my constipation, relieve my vomiting, improve my appetite, give me some strength that I can walk here and there. And definitely, I can tell you, we can give very, very good and very, very quick results in such cases. And that's what I want to share, and I want to teach all of the participants in this cancer webinar how to do this. Now, first is what we need to do, and I think most of us know by now that what we need to do, and this we will achieve by learning how to do it in the cancer webinar.
Sure, sir. Yes. So, sir, the next question would be, since it's a very long-standing disease, and many a times we see that the relatives of the patient also try to convince them not to go for homeopathy, because there are very myths that homeopathy is a slow treatment. So, how to convince patient to be or exclusively on homeopathy and to be there for this long treatment? How to convince that?
Yeah, so again, it comes to the same thing, Karishma. Mm, Majority patients are coming to us after everything has failed. So
Mm.
many patients that I treat in cancer, no, they are exclusively on homeopathy. Majority of patients that I treat are exclusively on homeopathy, because they know they don't have any other option. And it is very easy to convince them if I show confidence and if I show expertise. When I tell
Okay,
them
sir.
that I have worked at this hospital, I have seen this many cases, I have worked with this clinician, and when some oncologist is referring cases, see, last week I saw one case of salivary gland cancer. That man is, he's been with me for 6-8 months now. His cancer is advanced stage. He was advised chemotherapy. He had already taken chemotherapy 2-3 years back, but still the cancer relapsed. So this time he didn't want to go and take that, but his doctors advised, no, no, you should take. So I said, believe me, I can give you relief. At least wait with me for 1 month. This is how we have to convince patients. Give me 1 month's time, you will see the result, then you will only understand. That's why that quick relief is important. If you gain the confidence of the patient by giving them relief first, then they start trusting you. Then they know that this guy knows what he's doing. You know, he's an expert in this and he knows what he's doing. I can see the result already. So I gave him treatment. He started feeling better in the first 1 month. So he never took chemotherapy. After 6-8 months, I said, go and meet your oncologist. He went, he met them. They were surprised. They said, wow, how come there is no advancement of cancer? So they took my number and they said, we will refer cases if again after 6 months we want to observe you. If again in 6 more months there is no advancement of cancer, or we want to refer our cases. We are only having headache. Our patients are not getting better. After certain stage, we are not able to help patients. So even oncologists will start referring cases to you. So don't worry about all these things. Can I do? How to do? Does homeopathy works? 100% homeopathy works. It, like Hahnemann says, if you don't give relief, that means the homeopath has failed and not homeopathy. And focus on developing ability, focus on developing talent to treat such cases. That is what this webinar is meant for. How to develop this ability so that you are able to give such results consistently. And don't worry, this is, even though this is the most advanced of pathologies, you will have the most consistent of results exclusively with homeopathy. If you do it the right way, if you do it the correct way, and if you develop the skill and ability.
Correct, sir. Correct. So I would like to tell all our participants about the webinar that will be happening on 4th Feb and 5th Feb. So this webinar is actually happening on the occasion of World Cancer Day. So to celebrate that, we are hosting this webinar, and the speaker is here with us, Dr. Shrikant sir. He is going to be the speaker for the webinar. And in this webinar, the topic is barriers in cancer care. That is, what are the barriers that a homeopath faces during case taking in cancer cases. So this is the main topic that we want to speak during the webinar, because up until now, even sir has given many webinars, and in that sir has shown his results and how the cases are treated. But there are many cases in which we face many barriers, like there is a miasmatic block, or the patient is suffering from symptoms after taking the conventional treatment, that is the radiotherapy, chemotherapy. So in this webinar, we are going to discuss many of these barriers, and I would like to request all our participants to go through
Yeah.
our profile and
Just
watch the brochure.
one thing,
You will get
Karishma,
all the
just one
details.
thing. By
Yes, sir.
barriers, definitely, as you said, miasmatic barriers, but also barriers in the form of how to take a case, where to find characteristic symptoms. You
Yes.
know, many times we are facing difficulty. Cancer patient does not talk. I don't know where to get characteristic symptoms, or I don't know out of all these symptoms what is characteristic. How to get mental symptoms? How important are mental symptoms? How important are these causes? For example, nowadays in female they will say because she took HRT for a long time, that is the cause of cancer. So should we address that first, or give a constitutional remedy or indicated remedy? How important is to cleanse the body of the side effects of hormonal therapy or some implant, some heavy metal implant in body? How to address all of this? How to find characteristic? How to take mental symptoms? How to overcome all these obstacles? We will learn.
Yes, sir. Sure. So I would request all our viewers who are live with us to join us for this webinar. And also, one more thing is, next Thursday we will be having one more live session like this. And in that session, we will be addressing some more difficulties, more questions that arise during case taking in cancer cases. So see you all for today, and let's meet in our next Insta Live session. Thank you, sir.
Okay. Thank you, Karishma. Bye.
Yes, sir.